Kicking things off, the population of the young LGBT minority men in the Bronx are at the greatest risk for contracting HIV. The rates of those testing positive increasing daily. The Adolescent AIDS program at Montefiore is launching the LGBT program for youth and families, a symposium that's going to address some of the issues that are pressing against the LGBT youth. And here to tell us more about the program is the director of the Adolescent AIDS program at Montefiore Medical Center, Dr. Donna Futterman, and welcome to the show.
Hi, Darren. How are you?
I'm doing good. Good. A little bit of an alarming statistic.
Oh, absolutely. It's terrifying that more than 30 years into the epidemic, we see increasing numbers of young MSM, young men who have sex with men, getting infected. In fact, young men who have sex with men is the group with the highest rate of rise of any part of the population in the U.S., and in the Bronx, we're right in the center of that epidemic. Every month, 1,000 young people are infected with HIV, and the vast majority of them are young people of color.
1,000 people?
1,000 every single month. That's 12,000 a year. It's shocking that this far into the epidemic, we still have such high numbers.
Any real reason why we're seeing these numbers rise?
I think a lot of it is that people have forgotten about HIV. They don't see people sick. They don't see people dying in the way they did. And as a society, we have, in a way, dropped the ball. It's said that every 5 years there's a new generation, so the kids in high school today won't be there in 5 years. So unless we give them information about HIV and AIDS that's fresh, that addresses their concerns, we're going to really miss young people. They're just not going to know about it. So we need to keep at this, and we can't drop the ball, or it shouldn't surprise us that we'll see increasing numbers.
Now, are young people the ones that are extremely high risk right now?
Absolutely, and that's because they didn't live through the years of the epidemic. I don't know if you saw or heard, or your readers saw, or your watchers saw or heard, but just this weekend, HBO had a show on TV called The Normal Heart. And what that was a review of the early days when we had nothing, when tens of thousands of people were dying of HIV and AIDS because we didn't have medications. But right now we see that HIV and AIDS is much more treatable, so we don't have the images of people dying, getting sick, and young people don't realize that the epidemic is still here, and despite treatments being much better, it is not something that you want to get.
There's a problem, though, because in many instances, this is preventable.
Yes.
And yet, still, the education is not out there, or at least people are not even taking advantage of the fact that this is preventable. So I guess what, for somebody who's out there watching, can be done to prevent HIV that we can be able to share with our viewers?
Well, the first thing is to realize that HIV and AIDS is still here. It's affecting our youth. The second is it's affecting some of the most vulnerable members of our community. So young gay men are not embraced in society. Despite things being much better for gay people, we have gay marriage, there's still a lot of prejudice and discrimination so that young gay men feel they have to hide, they can't be open in the schools. So that's one part of prevention, is we have to talk about and value their lives the way we value absolutely every young person. The second is we've made even progress in prevention. Now you can take an HIV medicine every single day, a pill, and virtually prevent getting HIV and AIDS. So that's another piece of the prevention. Then we have to let go of our unwillingness to talk about things like condoms. I mean, when do you see condoms on TV or in videos or in the movies? It's still not part of everyday culture, and it's not integrated as an expectation. If you're going to have sex, you got to wear a condom. The same way you get in a car, you got to put on your seatbelt. So we need to keep up these messages. We've had seatbelt laws for years, but we have to keep launching campaigns to let people know that seatbelts save lives. So we need to do the same thing with condoms, with other forms of prevention.
So next Thursday, June the 5th, is going to be the symposium. It's going to be this conversation and this dialogue. For people who are going to be a part of the symposium, what are they going to be actually able to partake in?
Well, the first thing is family. The lives of gay kids are so affected by how their parents feel about them and treat them. So we want to engage parents, we want to engage churches, we want to engage community organizations to let them know that explicit support of gay kids is crucial for their health and indeed for their very lives, whether it's higher rates of suicide or risk for HIV. These kids, if they're rejected by their families, have 3 to 5 times the rate of bad outcomes happening to them. The second is we want young people to know that there's a place for them, that there's health care available for them at all of the Montefiore clinics that's going to be gay-friendly. We're even launching a program of health care for transgender kids who really suffer greatly in a system that doesn't understand them and provide them with the love, support, and proper care that they need. The third is we're going to be working with medical providers all over the Bronx to improve their care for young gay men, for lesbians. I mean, there's so many myths out there. Lesbians want to have children. In fact, there are more gay families in the Bronx than any other part of the city. Mm-hmm. So we need to really embrace that through our health care and through our mental health care, that the gay community is part of our community and is a strong part of our community and leading.
When you talk about young gay men particularly, what are some of the major issues that are actually affecting them right now?
Well, I would say the number one health concern is HIV and AIDS. This is a devastating, life-threatening disease that you don't have to get, yet more and more young people are getting it. At least once a week, sometimes 6 times in a week, we'll get a referral of a new young person who's just found out they were gay. And what a heartache to feel young black men or young Hispanic men getting this infection and they don't even realize they're at risk. The second is sexual infections. I mean, sometimes people brush it off. Oh, I had chlamydia, I had gonorrhea, I had syphilis. It's not something to brush off because it affects your health. You can transmit it to others. Almost half of all young gay people in almost every single culture in the world have sex with the opposite sex. So if you're a gay man, you're not just having sex with men, you're also, half of you guys are having sex with women. And so anything that affects young gay men not only is important for them, but affects society at large.
So we have the Adolescent AIDS program at Montefiore Medical Center, and Dr. Donna Funderman is here with us. For somebody who wants to know more about your program, give us a little bit about it before we have to let you go.
Thanks so much, Darren. The Adolescent AIDS program has been around since 1990. We've provided care for HIV-positive youth. But in the last year, we realized that we could expand our services to work with all gay kids, not just those with HIV. We've done testing for years, and testing is a crucial part of the work that we do, testing for HIV. But we need to dig deeper. We need to reach the young people way before they're at risk for HIV and help reinforce that their lives are incredibly important to all of us in the community.
Well, we want to tell you that if you want to find out more about this, the LGBT program for youth and families, Thursday, June the 5th from 1 to 6:30 at the Tishman Learning Center at Montefiore, 100 East Gun Hill Road. And for more information, you got to RSVP by May the 30th. As you see the contact person, if you can't see on your screen, Lindsay DeBose at 718-882-0232. And or you can visit the Montefiore website. There you can find out more information and be a part of this very special symposium as we try to put a dent in this problem that is seemingly plaguing our community. And Dr. Funderman, thank you so much for coming and sharing with us.
Thanks, Darren. It's great to be with you.
Good to have you. Stay right here with us.